Hello, everyone. My name is Scott Miller, and I'm the chair of the board of directors at the National Hemophilia Foundation. I'm honored to welcome you to NHF's first ever virtual Bleeding Disorders Conference. 2020 has been a year of change for all of us. We've had to radically adjust to new realities in a way that was much faster than we ever dreamed. Due to the coronavirus pandemic, we've had to face homeschooling, working from home, loss of income, loss of jobs, loss of insurance, and most of all, an absolutely devastating loss of life. I know that this has been difficult for all of you. It means a great deal to all of us at NHF that you've come here to join us at this conference when we know that you're still dealing with issues at home. We are still a community, and we at NHF are determined to be here for you no matter what. While we would rather meet with you in person, if we don't recognize the need for prudence during time of health concern, who will? That said, we are experiencing a period of accelerated innovation that has allowed us to bring you this conference virtually, allowed for more transparency in our governance by streaming our board meetings, and allowed us to find more efficiencies in our processes at NHF that benefit all of us as a community. I would like to thank our platinum sponsors, CSL Behring, Genentech, Novo Nordisk, Sanofi Genzyme, and Takeda. Please take some time to visit the virtual exhibit hall and learn more about them and their products and programs. Also, 2020 has been a year where we all had to adjust to new realities. But for many people in our community, it's been a year where the realities of the injustice perpetrated on their everyday lives have been brought to light in a harsh and brutal way. We've seen protests, violence, rage, and solidarity sweep through our biggest cities and our smallest towns, asking for justice and equal treatment for those in the Black and Brown communities who are our fellow Americans, our colleagues, our friends, neighbors, co-workers, and humans walking the same journey we are, the journey of life. This has been a time to have an open conversation about race in our valued institutions. The board at NHF recognizes that to fully serve the bleeding disorders community, we must reflect the community in its entirety. At our May board meeting, the entire board recognized that our recent board elections have resulted in a board that no longer reflects the bleeding disorders community. Our board right now is predominantly white and male. We have 2 female board members and find ourselves for the first time in many years with no minority representation. That needs to change. But to do that, we need your help. Recently, we opened the nominating process for the NHF board. Information was sent to all chapters, and we've also continued to reach out to outside the community as appropriate for skills that we currently don't have represented on the board. We're looking for people who want to make NHF an organization that leaves no other behind. We're looking for people of all races, all genders, all sexual orientations and ethnic backgrounds to bring their knowledge and passion for our community to help move our organization into the future. If that sounds like you, I hope you'll go to our website and consider nominating yourself. If that sounds like someone you know, reach out to them and talk to them about nominating them. Please know that we take this process very seriously, and your perspective is valued and supported. Just go to hemophilia.org and go to the Board of Directors page for more information. This can't be understated. We need new voices speaking for our community because the years ahead of us are going to be full of all kinds of change, new therapies, new advancements, and with them, new challenges. We need to continue to embrace new ideas, and one way to do that is to invite new thinkers to the board. Now, when Val Bias left NHF after 11 years of service, we knew that we were going to need to find someone exceptional to replace him. We wanted the National Hemophilia Foundation to play a more vital role in research into better treatments and cures and improving the quality of life of people with bleeding disorders. Therefore, we needed someone who had a true understanding of not only the science of bleeding disorders research, but who genuinely cared about the community. We needed an individual who could continue our trajectory, finish the work that the team at NHF had begun, and continue our momentum to the next levels of success, defined as higher levels of treatment and patient services for members of our community through research, advocacy, and education. Importantly, this individual must be someone with a passion for our mission, a leader who could work with a dynamic team, and someone who would work well with our chapter members. After an extensive international search, which included representation from the chapters, we found all of that in Dr. Leonard Valentino. Dr. Valentino brings more than 35 years of experience as a researcher, clinician, and executive for people with bleeding disorders. I'm honored to introduce him and let him tell you about our vision for the future of NHF. Now, when you make a hire of this magnitude, there's always a voice in the back of your head that says, did you make the right decision? Any concern we had was completely erased at Washington Days, which was among the first days of Dr. Valentino's tenure. He was introduced to give remarks at the morning session before we went on the Hill. Len didn't talk about advocacy. He didn't rally the troops to meet with legislators. He didn't make a plea for funding. Rather, he told the group to wash their hands, cover their face when they cough, and follow basic protocols to prevent the spread of the flu. Certainly, it was flu season, but COVID-19 was already present in the Western US, and this was more than a month before the CDC imposed similar guidance. His speech told us two things. He's a physician first, and it's not about him, but the bigger picture in public health. That's exactly what we need in this community and exactly what we got. Thank you for listening, and thank you for coming to our conference. Ladies and gentlemen, it is my distinct honor and privilege to introduce the President and CEO of the National Hemophilia Foundation, Dr. Leonard Valentino.
Good morning, good afternoon, and good evening. Welcome to the Virtual Bleeding Disorders Conference. What I'd like to do is to give you a vision for the future of the bleeding disorders community, stronger together and speaking with one voice. I'd like to extend my welcome to NHF's first Virtual Bleeding Disorders Conference, a virtual experience that I'm quite excited about. It brings new experiences and opportunities for us to connect with people all over the world. Our commitment to excellent education remains paramount, and it's education to patients and providers. We're together here, but we're together with a wider audience. For the first time, our conference is free for anyone who chooses to come. We have patients and providers from all over the world. Despite being virtual, there are still ways for us to come together and make connections. Connections to each other, but also with the speakers. Please ask questions, answer polls, and follow up. Follow up with each other, other participants, but importantly, follow up with our speakers and other experts, and stay connected with us and with each other. I started at the National Hemophilia Foundation on February 17th. In just 3 weeks, the world was changing and continues to evolve. We had to close our offices due to the coronavirus pandemic. We had to shift everybody to working from home, getting them equipment and phones and office supplies and everything else that they needed to do their job. Staff was working from their kitchen tables, juggling homeschooling, parenting, and all of the other responsibilities that they had. Not exactly what I expected. But I knew where we had to be. We couldn't interrupt our service to the community. You would still need us, and we needed to be able to give you what you needed. We had to find a new way to do it, and I believe we did. And I hope that all of you will agree that we've been responsive to the needs of the community and will continue to adjust based on what you need, but we can only do that as we hear from you. So please continue to tell us what your needs are and what you want us to help you with. A question that I ask myself every day is, what is my purpose? Why do I come to work? Why do I get up and do the things that I do? And for me, the answer is pretty simple. And I think it's the same for everybody at the National Hemophilia Foundation. We come to work because of you, because of all the patients that need our help, need our education, advocacy, and the support of research. I look at the mission of the National Hemophilia Foundation, which is dedicated to finding better treatments and cures for inherited bleeding disorders and to preventing the complications of these disorders through education, advocacy, and research. Now, within that mission and vision, there's a key stakeholder, and that key stakeholder is you, patients, families, and all that are impacted by bleeding disorders. But that stakeholder community is much larger than that, and it includes the hemophilia treatment centers and all the providers in the HTCs, the providers of healthcare, payers, and policymakers are also important stakeholders. But it doesn't just end there. There's many, many more stakeholders shown on this slide. The stakeholder groups include all of the organizations that I list here. Many of these are other organizations that help support the community. All of these organizations have a significant impact on the inherited bleeding disorders community. And we look forward to working with all of these stakeholders in supporting this community. There's another group that's important, and that group is the philanthropist. Without the philanthropist, which includes all of you, we can't accomplish our goals. So we look towards philanthropic support of not only the National Hemophilia Foundation, but all the nonprofit organizations that are listed on this slide, because they all have a critical function and a critical role in this community. Now, in order to fulfill the mission of the National Hemophilia Foundation and bring education, advocacy, and research to the community, we need a plan. And I'd like to share with you a little bit of information about NHF's strategic planning process. We're currently in 2020 with an existing plan that I think about as our phase one. We're executing on that today at the Bleeding Disorders Conference. For 2021, we will be making some incremental changes to that strategic plan, changes that are predicated on input that you've provided to us. But I think the really exciting part of the plan comes in 2022 to 2030, where I'm looking for transformational changes that we can implement not only through NHF, but through the entire inherited bleeding disorders community. So how will we do that? How will we understand how to transform this community? Well, it starts with a vision. And the vision for the future is termed NHF's Blue Sky Project. It's our initiative to try to imagine the state of the inherited bleeding disorders community in 2030. And I know that that's a bold vision, but I know that we can do it with your help. Now, how have we started on this journey? Well, we've started the Blue Sky Project with expert panels that were convened in June and July. These panels include consumers, healthcare professionals, chapter leaders, other partners, including patients, and of course, subject matter experts. And who is a better subject matter expert on your disease than you are? So patients are critically important in this process. These sessions have been 90 minutes in length, open discussions with no agendas. The thoughts and input are not constrained by time, effort, or money. We've convened 12 panels, and we have an executive summary that's being developed and will be available for comment throughout August. That comment period will be an opportunity for all of you to participate in the Blue Sky Project. We look forward to receiving your input, your comments on the executive summary. So please participate. I'd like to talk for a minute on how the Blue Sky Project has helped shape NHF's vision. So the NHF Vision, currently in draft form, and I say draft form because it's still in evolution. Depending on the input that you provide, the vision could change. And we expect it to change based on your input. So please participate. At this point, the vision is about breaking barriers to create a path to a cure. And that's not a cure for just hemophilia A or B. It's a cure for all inherited bleeding disorders. And I emphasize all inherited bleeding disorders. How will we do that? Well, research has to be at the heart of that vision. Education and advocacy will help drive the support for that research. And if we're going to be able to reach this vision and have that blue sky in 2030, we need to ensure the sustainability of the organization to achieve our mission. Well, what has the Blue Sky Project taught us so far? Well, on this slide, I'd like to summarize 4 points that have been provided to date. Community within a community, health equity, leveraging technology, and sustainability. Let's deal with sustainability first. It's sustainability of hemophilia treatment centers, so vital to the care that our community receives. So important also is the pipeline of new hematologists for those hemophilia treatment centers, new physiotherapists, social workers, psychologists, pharmacists, and everybody that participates in the comprehensive care. We need to sustain those healthcare professionals moving forward. We need to attract the brightest young people into benign hematology, an important point as we move forward. Sustainability of the community in general. What does that look like in a post-gene therapy world? How do we meet the needs of the community moving forward? So sustainability of our community is vitally important. Next up is leveraging technology. Many of you probably have participated in a telemedicine visit with your hemophilia treatment center. We look towards telehealth as being ever more important in the future. For the last 2 decades, telehealth has been with us, but only because of this pandemic has it really brought forward the importance of telehealth and telemedicine and brought it to many of our living rooms and family rooms for our own individual care. So we want to be able to work with each of you on leveraging technology to bring better resources to this community. Wearable devices may be an opportunity to gain new insights into the inherited bleeding disorders community about range of motion, levels of activity, and many, many other insights that we can gather from non-invasive wearable devices. The use of webinars and other virtual formats, like we're here at the virtual BDC, leveraging electronic technology will be ever more important, especially if we're going to have a greener footprint. Leveraging technology might also be thought of in terms of gene therapy and gene editing and other novel technologies that are being developed by the brightest scientists that we have in the bleeding disorders community. So we think that leveraging technology will be a very important component of our future vision for the inherited bleeding disorders community. Something that we deal with on a daily basis is the inequities in diagnosis and care and access to treatment, whether that's because of cost or geography, socioeconomic factors. All of these impact on the inequalities that we see in our community. And health equity will be an important component of our strategic plan moving forward. How do we ensure equitable access to care? How do we ensure equitable access to the most innovative treatments that are available for patients with inherited bleeding disorders? So we look towards working with you on many initiatives around health equity. And finally, at the top is community within a community. And this was something that during our initial discussions took many, many different forms, but all coalesced around areas of commonality that slow the progress of a community. And what we mean by that is these are issues like poverty, hunger, homelessness. We talked a bit about climate change and the carbon footprint, social injustice, and all of these issues that can detract from the real goal for the inherited bleeding disorders community. We need to improve the quality of life and find cures for people with inherited bleeding disorders. But while we're doing that, I believe that we have an obligation to address poverty and hunger and homelessness and social inequity and all of these issues that have the opportunity to slow our progress towards eventual cures. So next, I'd like to look at the core components of the mission of the National Hemophilia Foundation and give you some of my thoughts and reflections. So the core components are education, advocacy, and research. In education, our goal is to inform stakeholders of discoveries and key issues that face the community. We want to empower communication and increase transparency between stakeholders. In terms of advocacy, it's access to comprehensive care, to the most innovative treatments and other innovations in delivery of care that you so desperately need. It's ensuring the sustainability of the comprehensive care model. It's advocacy to policymakers and lawmakers on behalf of the community. But we only can advocate if we know about what issues you're facing. We want to know about issues that are at the state level as well as at the national level. An issue that's in apparently only one state might actually be present in other states. And as a national organization, it's our obligation to bring all of those to the forefront and advocate for issues that you bring to our attention. I also think that our advocacy efforts have an opportunity to impact the global inherited bleeding disorders community through our outreach and leadership. We need to be good global citizens. Now, lastly, the core component of the mission is research. And I look to the National Hemophilia Foundation to foster scientific and technological innovations, to define patient-important research focus areas. But we can only do that through your input. I also believe that our obligation or our mission is about funding science and innovation to finding better treatments and cures for the inherited bleeding disorders that we provide services for. Let's look at the advocacy in a little bit more detail. It's advocacy to state and national authorities to provide access to care that meets the state-of-the-art standards of care for people with inherited bleeding disorders, for access to safe and effective treatments, for the nationwide network of chapters and hemophilia treatment centers, and the continuation of 340B programs that are so vital to our hemophilia treatment centers, but also to chapters who receive funding from Hemophilia Treatment Center 340B revenue. Adequate and fair reimbursement is important, and we want to ensure that that continues. The sustainability of hemophilia treatment centers is in jeopardy and has been for many years. We look towards our advocacy efforts to ensure that sustainability. The sustainability of our federal partners to support our mission. Those federal partners include the Centers for Disease Control and Prevention, the National Heart, Lung, and Blood Institute, and other arms of the National Institutes of Health. The HRSA, as well as other federal partners, are incredibly important to supporting the mission that the NHF has. And then, of course, advocacy for other key issues that face the inherited bleeding disorders community. Let's next turn our attention to research and training. I believe that our obligation, our mission, is to provide information and dedicated resources to finding a cure, funding research for a cure for all inherited bleeding disorders, not just for hemophilia A and B, but for all inherited bleeding disorders. the development and the sustaining of a multidisciplinary team of healthcare professionals who will specialize in the care of people with bleeding disorders. We have to have an ongoing pipeline of multidisciplinary team members to sustain the model that's been so important for us. To address unmet research needs, including achieving a better understanding and management of care for those with inhibitors, those with rare bleeding disorders, and of course, women with bleeding disorders has been and will continue to be an important focus for our research, training, education, and advocacy. The treatment of hemophilia is becoming ever more complex as we have more and more products currently licensed for use in inherited bleeding disorders, but many, many more in the pipeline that may soon come to the clinics. Product treatment and choices are going to be very important for patients to understand. Our goal is to optimize outcomes for patients, and understanding treatment and product choices will be very important in the future. And then, of course, identifying gaps and enabling research and training to fill those gaps. So you may ask, how will we accomplish all of these goals? We will accomplish these goals by listening. Who are we going to listen to? We're going to listen to you. It's critically important that you have a voice. We're not doing this for the organization. We're doing this for the community. The National Hemophilia Foundation exists because of this community. And we need to be responsive to the needs and the desires of this community. We can only do that by listening to what you have to tell us. One of the ways that we're going to be listening to you is around developing a national research agenda. The way we're going to do that is by gathering insights to identify key gaps in care from all stakeholders. And that includes patients, family members, healthcare professionals, federal partners, and all the other individual groups that were listed on that stakeholder map. These stakeholder input will be provided through focus groups. Some will be small, one-on-one meetings, others larger, like we did for the Blue Sky Initiative. But given the current COVID-19 and the coronavirus pandemic, much of this may be done virtually. The next way that we'll be collecting insights is by getting the patient and family experience through community voices in research. You may have heard about community voices in research, but I want to give you a little bit more information that this is an opportunity to provide your experience about living with a bleeding disorder. You can compare your experience to those of others that are like you. But importantly, it's an opportunity for you to have input into important questions facing our community. Questions around access to care, the direction of research, mental health issues, and so many other issues that we want to hear about from you. Now, another channel that we'll be using very actively is participating with our chapters in a survey of patients and families. It's very important that the chapters utilize their network to gain as much input and provide insights from a broad stakeholder group. So you can see that stakeholder meetings, those are going to be a relatively small sample size. We can't have everybody in a stakeholder meeting. We can have more people participating in the community voices and research. But we believe that the broadest input can really be through chapter surveys of patients and families. That's an opportunity for everybody in the inherited bleeding disorders community to participate. And I encourage each of you to participate in one or more of these opportunities if it becomes available to you. Next, we need to gather input from our regional coordinators, our regional directors, and the Hemophilia Treatment Center staff on where they see the gaps in care. So again, providing a well-rounded, comprehensive view of the gaps in care will guide the research that will be done. Now, how is that going to be implemented? How are we going to decide on that? This is not the National Hemophilia Foundation's project. This is the Inherited Bleeding Disorders Communities project. We look towards impaneling a steering committee. And with that steering committee, we will be able to take broad stakeholder input and modeled after the National Heart, Lung, and Blood State of the Science for Inhibitors program that was led by Dr. Donna D. McKelly when she was at the National Heart, Lung, and Blood Institute. Donna D. McKelly is now a consultant for the National Hemophilia Foundation, sharing her experience and her knowledge with the NHLBI State of the Science for Inhibitors with us so that we can broaden that program to the inherited bleeding disorders community, not just inhibitors. So we look towards putting together a steering committee of multiple different types of stakeholders. So broad stakeholder input into the steering committee, and then the steering committee will empower working groups to work on different areas that you will bring to their attention through the different channels that we've talked about, the ways that we're going to gather insight into those key gaps in care. The steering committee will evaluate all of those and make decisions on where the focus should be, and then empower those working groups to work on each of those focus areas, creating a strategic action plan with that broad stakeholder input. Well, if you still haven't had an opportunity to participate, then there's still yet one more opportunity. And we're looking towards having a research summit, a summit that would be available and open to the entire inherited bleeding disorders community. We look towards being able to do that in a face-to-face meeting in 2021. We believe that by the second quarter of 2021, we actually may be able to have a face-to-face event. Now, if we can't have a face-to-face event, then we will commit to doing that on a virtual basis, because we believe that having this research summit is so important to advancing the inherited bleeding disorders community agenda forward, that we need to move along with this. After we have broad stakeholder input, we will have a research summit. Well, what are we going to do with that research summit? What are we going to do with all of that information? Well, then it's funding key research initiatives. So the group will decide what those initiatives are, and then it will be up to the community to support those efforts. So we're going to support the key initiatives that the research agenda will create, and we're looking forward to the entire community providing input. You notice that on the previous stakeholder slide, we had philanthropists being an important component. Now, many of you may not be in a situation where you can actually provide monetary input into the research agenda, but you certainly can provide your thoughts, your knowledge, your insights into it. Then there's others who can provide advocacy for the research agenda once it's rolled out. Others may be able to provide support in terms of education. But we want everybody to be a participant in this national research agenda. This is not for NHF. This is for the inherited bleeding disorders community. It's for all of you and all of us to move this forward. So lastly, I'd like to invite all of you to come on a journey with us, with the inherited bleeding disorders community, on a path that we don't know where it's going to take us. It may be somewhat circuitous, but we want to go on this journey. We want you on the journey with us to continually help us refine the path that we're following. And only through that effort, combined with your insights, your input, and along with all of the other experts that we're going to pull together, will we be successful in bringing a national research agenda to the inherited bleeding disorders community. So I hope everybody will have a good conference. I hope you all learned something. And again, stay connected with each other and with the presenters and healthcare professionals that are speaking during this conference. With that, I'd like to thank you and offer the opportunity, if you have questions or want to provide insights to me directly, send me an email. I'm listening. Thank you.
Hi, I'm Dawn Rodolini, Chief Operating Officer of NHF, coming to you live, or rather virtually, from Pittsburgh, Pennsylvania, my home. Welcome to our very first ever virtual Bleeding Disorders Conference. As I imagine you all watching, sitting in your homes, joining us in the virtual crowd, I wish that each and every one of you are healthy, safe, and doing well. I hope you've been able to look over our program to see what we have in store for you this week. There's so much to learn at this conference, and we really tried to have something for each and every one of you. There are sessions for VWD, women with bleeding disorders, adult men, parents of children with bleeding disorders, great sessions for spouses and partners, just to name a few. I hope you will join me in attending as many sessions as possible. Here's just a sampling of what you can expect.
Hello, my name is Guy Young. Here I am in my home in California, and I'm very much looking forward to the virtual meeting of the National Hemophilia Foundation. While I hoped that we would be seeing each other in person, obviously we cannot do that this year, but hopefully next year. In the meantime, there's a great lineup of talks, and my talk is going to be on advances in hemophilia treatment. I'll be discussing all the latest advances from the clinical trials that have recently been published, including data from the recent World Federation of Hemophilia meeting, as well as the International Society of Thrombosis and Hemostasis meeting, both of which were virtual and occurred in June and July. So there'll be lots of really new updates for you to learn about all the various new treatments that are coming, and there's many, many of those. So I look forward to giving the talk, and I hope that you will enjoy it, and I hope that you'll participate and listen. Thank you.
Hi, everybody. I'm Tammy Singleton. I'm a pediatric hematologist from the Mississippi Center for Advanced Medicine, and I bring you greetings today, actually from the city of New Orleans. I am so excited that we're going to have an opportunity to be together during this virtual NHF conference. And I'm especially grateful that we can at least do this, right? We can be together and have a great conversation. So please join me. We're going to talk about something that I think is really cool. We're going to talk about gene therapy, a candid conversation. I certainly know, many of us know and can appreciate that gene therapy is possibly right around the corner. It's exciting, can be daunting. So we're going to have a very patient-centric conversation, a broad conversation where we will feature a patient who's on a clinical trial, as well as patients who are on other therapies within our community. So come on, hang out, join us for a great candid conversation about gene therapy. See you there.
Hello, I am Dr. Veronica Flood, and I am here to advertise the von Willebrand session later in this meeting. There are going to be new published guidelines on von Willebrand disease, hopefully in press this winter, and they've been co-sponsored by NHF along with ASH, ISTH, and WFH. A group of physicians, scientists, and patients, as well as advocates, have been working hard on these diagnosis and management guidelines. And on August 8th, from 4:15 to 5 p.m. Eastern Standard Time, we will be discussing these guidelines, how they were created, and previewing the draft forms of several recommendations, including new guidelines for the use of von Willebrand factor concentrate for prophylaxis in von Willebrand disease, and treatment of heavy menstrual bleeding for women affected by this issue in von Willebrand disease. Everyone in this audience has had a chance to participate in this process through the scoping survey and through the public comment period, but we are very excited in a few days to be able to bring you some actual results of this process. So if you're interested in the guidelines, you want a sneak peek at the process and a sneak peek at the recommendations, please join us on August 8th, 4:15 to 5 Eastern Standard Time. Thank you.
My name is Jeannie White, and I'm the mother of Ryan White, and I'm also the mother of Andrea White. I am just a mom. I'm a mom that because of a misunderstood disease called AIDS, my life changed overnight. It was not anything I thought I was going to have to experience or worry about. But in 1984, my son was diagnosed with AIDS. He was one of the first children and first hemophiliacs to come down with AIDS. It was a rough time. It was a new disease. It was fatal. And this, I want to share with you Ryan's story from being born with severe hemophilia to later on contracting AIDS and his fight to go to school. And then the Ryan White Care Act, which was named after him by Senator Kennedy and Hatch. And it's ongoing today, and it helps people get their drugs, care, and treatment. And it's been something that I think I've been so cherished to be involved with. So please join me and with the 30th anniversary of the Ryan White Care Act please join me and let me share my story with you of how Ryan lived and not died.
Hi, my name is Patrick James Lynch. I'm a filmmaker and content producer from Los Angeles. I have severe hemophilia A, and it's my distinct honor to lead two notable events during the virtual BDC this week, one at the beginning and one at the end. On Sunday, August 2nd at 6:30 Eastern, I'll be hosting the 6th Annual Teen Impact Awards, where we will recognize and celebrate 58 teens from this community for making an impact in homes, schools, and communities across the country. Again, that's Sunday at 6:30 Eastern, and there's more information at teenimpactawards.com. And then towards the end of the week, on Friday, August 7th at 7 o'clock Eastern Standard Time, 7 p.m. that is, there's a mental health session that's titled I'm Not Okay, during which I'll be screening a 40-minute documentary that I helped produce called Let's Talk. Let's Talk is an immersive journey through the lives of 5 members of our U.S. bleeding disorders community as they open their hearts and lives to show us how we can gain strength through struggle and to show us that we're not so different or alone after all. The screening will be followed by a brief expert talkback along with a preview of NHF's mental health educational sessions that will come the next day. To give you just a hint of what the film is all about, I will now play a brief teaser. I hope it resonates, and I hope to see you on Friday.
It was early morning. I woke up before sunrise, and something drew me out to this mountain, into this chimney right here. And I climbed up it, took my spot in the edge right by the cliff face. In that moment, I decided that yes, this is that moment. I want to die.
The mental health systems are only set up, from what I see, if you're at your wit's end, nothing else to do. Was diagnosed with the HIV diagnosis I was 12. And when that came out, I was like, okay, fine, yeah, so I'll be dead in 3 years. That's basically what I was told.
There's one memory I have where I started at a brand new school and I stood up to go throw trash away at lunch. And when I came back, there was just blood everywhere, all over the bench. And it was like the room went silent. Everyone was like, oh my God, is that your period? And I was just mortified. So I carried that reputation basically until I graduated high school.
During our summer camp program in Northern California, there are 73 people. Then the next year is down to 50 because throughout the whole year, you're getting phone calls of the guys just dying. And it began this process for me of shoving the stuff down, where it's like, okay, I don't want to deal with it. Let me just take care of everybody else before taking care of me.
I had total school phobia, but I was determined to be the first one in my immediate family to graduate high school. After I graduated, it was, how the hell am I gonna get to college? So the day I moved in to the dorms was a pretty happy moment.
There's still stigma across the board. Many of the different television shows, the representation of those who have mental health challenges, it's not positively phrased, that you can have a mental health issue and be successful.
I've hiked back up this trail maybe a dozen times since. For me, it's a way of realizing how precious life really is, how easily it could just be taken away from you.
Reach out, reach out, reach out. The first person may not get it, or you may feel he or she doesn't get it. Keep reaching out until you feel you've been heard.
Hey, it's Dawn again. No bleeding disorders meeting is complete without some fun, right? Our final night event will be Saturday at 6 p.m. Eastern Time, and it is going to be virtually epic. I hope you'll join us in the fun. I am definitely checking out the cocktail mocktail class. On behalf of all of us at NHF, Thank you for coming to this conference. I know that we all miss the face-to-face interaction and connecting with our community of friends across the bleeding disorders community. But we are a family, and when things get tough, family sticks together. We lift each other up, and I hope you feel the same way that I do about this week. Have a wonderful meeting, and I will see you at the final night event.